Welcome to Concussion and the Gut Brain Connection. Thank you so much for being here. I'm so excited to introduce you to concussion through a lens which you may not have looked at through before. I first want to begin by acknowledging the traditional custodians of the various lands on which we all gather and are meeting today, and I'm presenting from Wadawurrung country. I pay my respects to elders past, present and emerging. Welcome. I'm so excited that you're here. Thank you for tuning in. Concussion, it's an injury that's everywhere in the media right now, and yet so often underdiagnosed, undertreated, and leaving so many people feeling hopeless about ever feeling better. We're also watching the insidious repercussions of concussion and repetitive impacts play out in the news every single week. More and more diagnosed neurocognitive disorders in retired athletes. But this isn't just about athletes. They make the topic relatable, but this reaches so much further. It affects children right through to the elderly, and it happens in all sorts of contexts, not just sport. Accidents and injuries like car accidents and violence, including family violence, emergency services and the military with blast exposure, which is something that often is not considered, and lots of other different contexts. So if you ask around your family and friends, you will find many, many concussion stories. They are everywhere. You're here maybe because you've got a gut feeling, pardon the pun, that there's more to the story. There's more going on. You might see it in yourself if you've experienced concussion, or you see it in your patients or players if you see clients with concussion. And you're wondering what more can we do? If you're a practitioner, you might even think you don't see concussion patients, but I assure you, you do. And once you start noticing this, so many things can change in your practice and your patient outcomes. So thank you for taking the time to be here and for being curious about a topic that quietly shapes so many lives and so many health outcomes. So I'm Louise, I'm a clinical naturopath, and concussion is the space that I work in, from risk mitigation strategies all the way through to people who are decades past their injury. It's a topic that's often been spoken about in my house with family members playing and coaching football and my little ones becoming interested in sport. But for me as a clinician, the pennies really started dropping or raining on me when I was doing some adult ADHD training with an incredible naturopath by the name of Jules Galloway. And it was during a discussion one day on chronic low-grade neuroinflammation that I realized how much of what is required to recover from a concussion isn't commonly dealt with in concussion care. There was just this huge slice of the pie just missing. And the more I looked, the more I saw a systemic gut-brain focused approach is essential for concussion recovery. And importantly, that harnessing the power of the microbiome goes a long way to fill that gap. What I've also come to understand through working with many clients at varying amounts of time post-injury is that recovery isn't just about getting back to play or getting back to functioning, getting back to work. For so many, it's about getting their life back. So you might be watching this and you might be someone who suffered a concussion injury. You might be parents of children who play sport, practitioners, coaches, clubs, people who've lived through it themselves. So the purpose of this is to give you some insight into what I do and why I do it, to flip the script on what has always been thought of as a fairly unserious injury, and to show you that it is really quite complex and systemic. So a quick recap of where we're heading, but I'll say this up front, there is so much to know about concussion and so much more we can do to support these injuries that I can't possibly fit it into this 30-minute webinar. But what I can do is open the door and give you ways to connect and to go deeper. But this is so much bigger than me. It's bigger than this webinar. This issue spans the globe. And when we can do better, we should. And that's why I'm here today. So let's start with the official definition, and then let's kind of break that down a little bit. This text here is directly from the ANZ concussion guidelines. This is the standard definition that is a concussion in Australia and New Zealand. So force to the head or neck that causes the brain to rapidly accelerate and decelerate inside the skull. And that is accurate as far as it goes. It's just nowhere near the whole picture. So these forces stretch and shear the axons, the long fibers that carry signals from one neuron to the next. And that damage isn't confined to the site of impact. It can be scattered through the brain, which is what is meant by the term diffuse axonal injury. And then what happens next is called the neurometabolic cascade. So there's a huge surge or dumping of glutamate, the brain's main excitatory neurotransmitter, and it floods the receptors and drives widespread uncontrolled depolarization. Potassium pours out of the cells while calcium and sodium pour in, and the membrane, and that causes the membrane potential that neurons rely on to fire to kind of lose its ability. To claw it back, the sodium potassium pumps go into overdrive, and that work is really metabolically expensive. It burns through ATP, or units of energy, at a rate that the brain can't easily sustain, especially with all these other things going on. So the brain then will ramp up its glucose consumption to keep up at the very moment cerebral blood flow is falling. So demand climbs while supply drops, and that mismatch is the energy crisis at the heart of an acute injury. And while that's happening, this calcium that rushed into the cells is accumulating in the mitochondria, and it impairs the very machinery, essentially, that the brain needs to make energy and recover, and generating oxidative stress as it does this. So that's why the brain is so vulnerable in the days following a concussion, and why energy, or the lack of it, sits underneath so much of what we talk about. So what's happening in the brain is quite complex, and it's a lot. But it is just one part of the injury. And so here's how I want to reframe it for you, that the impact to the head is the trigger, but it's not the whole injury. And what follows, aside from that neurometabolic cascade, is a whole physiological cascade, a whole body response to that impact. And yet in so many contexts, this injury is still minimized and still waved off as being very minor. So in Australia and New Zealand, we have official concussion guidelines, and they have their place and they're the current standard. But in my clinical experience and my clinical opinion, they are incomplete and underscoped, and they stop at the brain and they treat anything else that comes afterwards as separate, but it really isn't separate. And that's the gap that I want to talk to you about. So why does this matter so much? I get very passionate about talking about concussion injuries, but there are so many people walking amongst us, or not, maybe they're hiding in their houses because they're so unwell. But so many people are still carrying the effects of these injuries weeks, months, years, and decades later. And it's massively underreported and underdiagnosed. So real statistics in this space are pretty hard to come by. And we'll talk a little bit about why. But the scale is massive. A scoping review published in PLOS ONE found that roughly half of people with a single mild traumatic brain injury go on to show long-term cognitive impairment. Half from one injury. And that sits completely at odds with the story that we're usually told, which is that you'll be right within a few weeks. Just rest. We also see really strong correlations between head injury and the major neurocognitive disorders, dementia, motor neuron disease, Parkinson's, and of course, CTE. So we know that chronic low-grade neuroinflammation is implicated in all of these. And I guess my point is this: if we know that fire is there, that neuroinflammation, even if we can't see it on a scan, then surely we should be doing something about it, especially when evidence-based tools do exist. We also see lots of mental health challenges post-head impacts and even loss of life that gets labeled as mental health. And then on autopsy, we see things like CTE. So the problem is huge and it's very real, and people are losing their lives. To give you a sense, a single mild traumatic brain injury is associated with around a 17% increase in dementia risk, and that climbs with the severity and number of injuries. But just being careful and really honest with you with these numbers, the statistics are really hard to come by, like I said, but these outcomes aren't driven by the injury alone. They are shaped by a person's pre-existing health, so their pre-injury health, and then they're shaped by what happens in recovery and in the years beyond it. So that's actually, whilst that is really confronting, is actually really good news, because that's quite a number of access points where a person's health and their outcomes can be positively influenced. So that's really cool. So just to recap those statistics, they're really hard to measure because it's chronically undiagnosed. Athletes hide their symptoms to stay on the field. Subconcussive load is a thing that's really not spoken about. So that's all those smaller impacts that never get reported, but they do count. And because some of these conditions are only confirmed after death, which makes their true prevalence almost invisible unless someone's donated their brain to research. And just this week, we've seen CTE confirmed in someone as young as 15. And I find that really confronting. There's even a terminology problem. The research splits depending on whether you search for concussion or mild traumatic brain injury. And so, if you're not searching for the right things, then you might not be getting the information that you are actually looking for. And even the people studying this are working with, an undercount, really. I want to read you this. This is a news article headline and a short paragraph from The Age on the 17th of June, and it's in relation to the rugby state of origin. Munster overcomes HIA scare to lift his Maroons to Origin decider. So that's the headline. He overcame the head impact assessment to then go on and win. Here's the little bit of text which I find really interesting. But as Munster flung that past, he was tackled headfirst into the unforgiving MCG turf. Doctors immediately forced him into the rooms for a head injury assessment. Any chance the Maroons had of remaining in this match and in the series seemed to rest on that 15 minutes of testing time. Thankfully for Queensland, the Melbourne Storm playmaker found a way to pass it and return for the second half. So if you just sit with that logic for a second, an entire State of Origin series resting on 15 minutes of testing time, and the language that this reporting uses with no sense of alarm at all is that he found a way to pass it and return for the second half. He found a way to pass the test to get back on. And that right there is a huge problem in one sentence, and it's a whole other discussion in itself. But the thing is that you might have experienced or seen as a coach or in your clinic or as a parent, that push to just get back out there and play on. And the doctors were so right in this situation to pull him in for an assessment. And I don't think that's actually the issue, but is 15 minutes enough time for a start? And that pressure, the series is on the line, it's riding on this one person. And it drives that culture of pushing through at any cost, and hiding injuries. But the problem is so much bigger than any one person. It's the injury itself, and it's everything we've built around it: policies, protocols, red tape, bureaucracy, the politics, and the staggering amount of money that is riding on these decisions. So that's what makes it hard to shift. And in professional sport, players are a commodity. But they also set the standards for all the levels below. And this filters beyond sport and just how we deal with concussion in general. So you can see that there are significant downplays of the injury, and that is systemic through society. So I'm on a bit of a one-woman mission to change that, to flip the script, to shift the paradigm, and to bring down the likelihood of these avoidable adverse outcomes, because I genuinely believe we can. I'd argue we can do so much better, both in mitigating the risk and in the recovery phase. And, just to show you how stuck the culture still is, if I leave a measured, factual comment, even a referenced comment on a sports post, the number of people who pile on insisting that there's no link between repetitive head impacts and these insidious conditions is absolutely wild. People don't necessarily want to know about it. Someone said something to me the other day that's really stuck with me. They said that in trying to explain to someone the damage that years and decades of contact sport, it's really hard for people to understand that. And so the way they explain it to people is by saying this: if you want to know what it's like for the brain playing decades of contact sport, then go and bang your head against the wall 5,000 times and tell me that there's no damage. And I was like, whoa, you're so right. That's, and, so maybe it sounds a bit confronting, but that is essentially the force that the head is dealing with in sports like rugby and NRL and AFL. But beyond the statistics is the humans, their lives and their experience. And these injuries can really be a point in time of never better since. And it's rarely, symptoms are a huge part of that, but it's rarely just about the symptoms. It's their ability to provide for their family, so economic stability. It's their relationships, their identity, their ability to live a full and happy life. So it's the person that someone used to be and they can't just quite find their way back. So if you're here because you suspect there's more to the story, or you've seen someone fall through the cracks, that their concussion was missed or dismissed or never picked up in the first place, and maybe you couldn't figure out why that person wasn't getting better, one thing I will say is that nothing is random and everything is connected, and that is a huge mindset shift. When you can view things in a connected way, then you can start to see things a little bit differently. So the 5 aspects of concussion most left untreated. I'm going to give you 5, but there are so many more, and we'll absolutely go deep on all of them in my practitioner training, and in my 12-week patient program, we deal with the things that are happening for that individual. But hopefully these 5 things will change how you see a recovery that's stuck. And the thread that runs through all of them really is the gut. So unresolved neuroinflammation. After an impact to the head, the brain's immune cells, the microglia, switch into a defensive mode. It's their job, and in the short term, that's exactly what you want. The problem is they don't stand down. They kind of get stuck in a loop. And this concept is called glial priming. And once those cells are primed, a second smaller impact, and it could really be anywhere on the body, can set off that whole inflammatory cascade again. If you've hit your head and you haven't supported your body back into balance, then weeks later, someone else knocks into you or you fall over or whatever it might be, the message is that you can reignite that inflammatory process. And that low-grade fire feeds itself, suppressing BDNF, which is basically, I guess, fertilizer for the brain, the stuff that helps it build and repair connections, but it disrupts memory. It's driving the brain fog, the mood changes, fatigue. And resolving it is almost never really part of the standard care. So, and brain inflammation in this context really does not always resolve with just rest alone. And number two, of course, my favorite topic, the gut. Within hours of a concussion, the intestinal wall becomes more permeable. And at the same time, the blood-brain barrier, that beautifully selective filter, has lost its selectivity as well. So now we have a leaky gut and a leaky brain together. And when the gut becomes more permeable, bacterial endotoxins like lipopolysaccharides can cross into the bloodstream, and that triggers an immune system to mount a defense, releasing inflammatory signals that circulate everywhere in the body, not just to the brain. But once those inflammatory signals reach the brain, they are continuing to keep the microglia active, that glial priming loop. And so you get this inflammation that just keeps going and going and going. Essentially, the gut fuels the inflammatory fire in the brain. But it doesn't just stop there. The brain talks back to the gut through two channels, through the vagus nerve, which carries direct signals through, and also our stress hormones, our HPA axis, cortisol, adrenaline, things like that. When the brain is inflamed and stressed, it sends signals back down that make the gut barrier even more permeable, and more permeability means more bacterial products can cross. More crossing means more immune activation, and then you're stuck on the hamster wheel. The loop runs itself. Aside from that, remembering that a huge chunk of neurotransmitters are made in the gut, and they play a role in the gut, but they also communicate with the brain via the vagus nerve. So when there is disruption to the gut function, your neurotransmitters also become disrupted. So they can't communicate with the brain as well. And then we have, mood, sleep, energy impacts that are a result of that as well. But something that I really want you to hear is that the microbial ecology of someone's gut before they were ever injured shapes how the injury plays out for them. So two people can have the same impact and end up in completely different places. And a lot of that is down to the gut and the very microbial species living in it. The balance of beneficial to gram-negative, the population, the number of species, the terrain, all of these kind of things make a difference. So in order to change post-concussion outcomes, we must work through the gut. And we do that by shifting the environment of the gut through diet, sleep, stress management, and targeted support with, herbs and supplements that bridge to get people there a bit quicker, so that bacteria driving inflammation can't thrive, and that the beneficial species that can reduce the severity of outcomes can proliferate. IPA, that is a substance that crosses the blood-brain barrier, and it's anti-inflammatory. So there are lots of beneficial things that can be produced from the gut that help heal after concussion. Once you shift the microbiome, the gut stops feeding the fire, and then the brain can get the space it needs to recover. Mitochondrial dysfunction, we talked about the energy crisis a bit earlier, the neurometabolic cascade. And now we want to think about what happens when it doesn't switch off. that demand for energy that has spiked at the exact moment that the supply has dropped. It's like getting hit with a massive power bill that you have to pay, but the power's been cut off. So you've got to pay the bill, but you don't have any power. For most people, that mismatch is temporary, but for some, maybe more than we give credit for, the mitochondria stay impaired and you're left with a brain that's chronically under-resourced at the cellular level. And that's why, units of energy for someone post-concussion, the expenditure is much more. What a normal day would be like for some people, be that mental or physical, can leave someone who's had a concussion completely flattened. And that's really signature of mitochondrial dysfunction, that fatigue that doesn't respond to rest. Because the problem is that they haven't recovered and their brain can't make enough energy to function in the first place. So now let's zoom out from the brain to the whole body and look at this systemic inflammation that is absolutely being driven by the gut. That inflammation that started at the impact doesn't stay in the brain through the gut-brain axis. It becomes a body-wide, self-perpetuating state with an inflammatory signals circulating everywhere. And so that a body in that inflammatory state can tend to overreact. A new small stress that you would normally be able to deal with, be that emotionally, environmental, physical, can promote a disproportionate response. The body is literally turning sparks into bonfires. And, the brain and the body are not having two separate conversations. They never were. And here's an observation that anyone who loves sport or is in sport might recognize, that how often after a concussion do you see an athlete go down with a lower limb injury, a hamstring, a knee, an ankle? It's really more frequent than you might think. And two things really drive that risk. The first is sensory motor, the vestibular system, the one that manages balance, coordination, reaction time, and your sense of where your body is in the space. And that takes weeks to fully come back from a concussion. And physios, osteos, and chiros can be absolutely critical in this space. Like me as a naturopath, I can't do that work, but they can. And so often, even when an athlete feels ready, their control and timing can be very, very subtly off. And then the second, of course, is the inflammatory terrain. After the head impact, all of these inflammatory cytokines floating around the body is a little bit less resilient, slower to recover. And you put those two together, and you're at much higher risk of injury. And I know I've said it 100 times, but, that impact doesn't just affect the brain, it affects the whole body. And then finally, one that rarely gets a mention is the hormones, our master communicators. And after a head impact, the stress hormones come to the party as well. So we know that blood glucose processes upregulate and cortisol and adrenaline spike, but in many people, they don't fall back into regular homeostasis. They stay dysregulated, and that plays a role in suppressing that BDNF, that brain-derived neurotrophic factor, that protein that drives neuroplasticity and recovery. And at the same time, we can see thyroid dysfunction, sex hormones shift out of their normal patterns. In men, you might see lower testosterone, particularly if someone's been dealing with post-concussion for a long time. And in women, estrogen can be dysregulated. And we know estrogen is neuroprotective. It directly supports mitochondrial function and neuroinflammation control. So with women or assigned female at birth, where someone is in their cycle, whether they're perimenopausal, postmenopausal, all that kind of stuff, it fundamentally changes how that injury can play out and how fast they can recover. And so hormones is interesting area where people can get lost because concussion and hormones is not something that's spoken about in the same sentence. So when a woman or AFAB is in perimenopause with lingering cognitive fog and fatigue, they will often get told it's just menopause, or a man with mood changes and low energy might get told it's just stress. But those things might be true, but they're not the whole picture. And that concussion that was never addressed is sitting underneath both of them. And no one's quite connecting the dots. So there's 5 things of many that can happen in the body with a concussion injury that are really not commonly dealt with in clinical practice. So holistic systemic care tailored to the individual, considering a person's entire health story, is really what makes a huge difference in concussion recovery. And knowing what to reach for and why matters enormously. So whether that's, you will find people self-prescribing things, and there's lots of options out there and lots of really clever marketing. But hopefully I've shown you that concussion injuries are far more complex than we've been led to believe, and we can't cover it all in one webinar. So I do extend an invitation to you to my practitioner training, where you'll have the time to take a deeper dive into concussion through the lens of the gut-brain connection. Because knowledge shouldn't just sit with one person. But these points are really interesting. We can change people's outcomes from a risk mitigation perspective through optimizing the gut in high-risk situations like contact sports. And it's also a competitive advantage to have an optimized microbiome. The acute phase, recovery, post-concussion, and protecting long-term health outcomes. So really making sure that people are being looked after well into the future, well after their sporting careers are over and long after the initial injury has passed. So yeah, here we go. Introducing Beyond the Brain, Systemic Recovery. This is my training for practitioners. Little webinar special that is available until June the 30th, 2026. So that's $250 off. And after that, it's $845. And really, the more of us who understand the whole picture, whether we're naturopaths, nutritionists, physios, osteos, chiros, exercise physiologists, doctors, the more people who can recover, the better the long-term outcomes. And multidisciplinary collaborative care is what the evidence supports. But recovery that ignores the gut and the systemic physiology of the injury will always be incomplete. So you can't rest your way out of a head impact alone, and you can't think your way out of it. So there's a great deal that can be done to give the body the conditions it needs to heal. And in Beyond the Brain, we will be taking a deep dive into all of those things and clinically relevant tools and resources, case studies, evidence, all of that kind of stuff. So please, would love to see you. We start on August the 19th, 2026. And there'll be 6 live sessions, which go for 60 to 90 minutes, lots of time for question and answer, all of that kind of stuff. And then for clients, I do one-on-one consultations, and I'm just releasing today my new 12-week Concussion Recovery Foundations. And this client program is built directly on the feedback of my concussion clients. So what they have needed, what has worked well for them, what they wish they had in their recovery, all of that kind of stuff. So please, check it out. Let me know your questions. I would love to, support as many people as I can, be that clients or practitioners, to really increase people's health outcomes across the board. Thank you so much for tuning in. I'm so grateful that you could be here. Please feel free to reach out on socials or any way to ask any questions, get in touch. I love to hear from you. Thank you so much.